If you are given a permanent weight loss solution, would you take it? Can one person or you permanently lose weight for the rest of your life, remain at your ideal weight? Let us talk about uncomfortable things. The thing everybody's thinking, but no one wants to openly talk about. Let us talk about bariatric surgery. Disclaimer, I have not had bariatric surgery or weight loss surgery or any kind of weight loss or cosmetic surgery. In this video, I'm going to share my research findings and opinion. Please remember, I'm not a doctor or healthcare provider. Only you and your doctor can make the decision to have or not to have weight loss surgery or bariatric surgery. So what is bariatric surgery? This is a surgical procedure that was designed to help that person with obesity lose weight. It works by reducing the food intake or the food absorbed. Who is then eligible for bariatric surgery? This is because not everybody who wants it needs it. That individual who has failed to lose weight by changes in exercise and has already tried dieting and has failed to lose weight is eligible. They've even tried exercise and have also tried weight loss medications. And please remember, or you should know, bariatric surgery will not replace the need for lifestyle changes, including a healthy diet and exercise. So now that we are clear on who needs it, who qualifies? Typically, that individual with a BMI, that is a body mass index of 40 or higher, or a BMI of 35 to 40, accompanied by obesity-related diseases such as diabetes, high blood pressure, and any other, and has already tried diet and exercise and failed to lose weight. So if you have a few pounds to lose, like 10 to 50 pounds, that's like 2 to maybe 30 kilograms, you may not qualify for bariatric surgery. So what is bariatric surgery? There are mainly 4 types of bariatric surgery. The first one is Roux-en-Y gastric bypass, RYGB. The second one is sleeve gastrectomy or vertical sleeve gastrectomy, commonly called VSG. Then we have biliopancreatic diversion with duodenal switch, commonly called duodenal switch. And fourth, we have the laparoscopic adjustable gastric banding. Please note that the first 3 are permanent and will not be reversible. So let's spend a bit more time on each of these. Let's look at the gastric bypass. In the gastric bypass, the upper part of the stomach that is attached to the esophagus or the food tube is actually cut and attached downstream to the small intestines. So this means it bypasses most of the stomach and the duodenum. This means that most of your stomach will not be used for digestion, although it will still be able to produce enzymes. Digestion will still proceed, and digestive secretions with enzymes from the pancreas and the bile will still be produced, and these two will join the food further downstream. And weight loss due to bariatric surgery that is done by gastric bypass occurs due to 2 reasons. One, the stomach is so small, as you can see, it's barely this size. So it means one can only eat a little amount of food. And then also because of the bypass that has been made, one can only absorb a limited or a small amount of food or nutrients. So in place of the gastric bypass, you can also have a mini gastric bypass, and this one is not as extensive as the full bypass. The second kind of bariatric surgery that is available is sleeve gastrectomy or vertical sleeve gastrectomy, commonly referred to as VSG. And in this case, 70 to 80% of the stomach will be cut. So this leaves a small stomach the size of a banana. And normally what happens during surgery, they use a kind of scissors that cuts and staples at the same time. That's why people talk of having the stomach stapled. The part that has been cut off is actually removed through a cut or what is called an incision in the abdomen. So if you're liking this video, please give this video a like and subscribe to the channel. Also share it with somebody who it may help. The third kind of bariatric surgery is the biliopancreatic diversion with duodenal switch, which we'll just commonly call the duodenal switch. This one kind of combines the gastric bypass and sleeve gastrectomy. First, a sleeve is done and most of the stomach is removed through a cut. And then the distal part of the small intestines is rerouted and attached to the pylorus. The duodenum is retained to allow the pancreatic juices and the biliary juices to actually reach the digesting food. And this happens towards the lower end of the small intestines. So the reason weight loss occurs is due to compromised nutrient absorption and the smaller stomach. The duodenal switch is actually less common than the sleeve and the gastric bypass. The fourth kind of weight loss surgery is the laparoscopic adjustable gastric band. And this one is reversible and the band can also be adjusted. Usually, the band is placed on the upper end of the stomach. In this way, the stomach inlet is reduced, but the stomach is not cut. This promotes satiety or the feeling of being full, and it means there is less room to eat, therefore reduces the appetite. So how long do the effects of bariatric surgery last? The results will vary from procedure to procedure and also from individual to individual. Many times, weight regain may start about 2 or 5 years after bariatric surgery. Most people lose the bulk of their weight in their first year, and this is usually called the honeymoon phase. However, for sustainable weight loss, even after bariatric surgery, there must be lifestyle changes, and this will involve a sensible diet and also exercise. So at what age is bariatric surgery allowed, or what age can it happen? Legally, anybody above the age of 18 can get bariatric surgery. However, some doctors say above the age of 25 because it's assumed at this age you have attained a level of maturity. There's no clear maximum age, but many doctors will cap the maximum age at 70 years. However, biological age is considered. An individual may be 75, but their biological age is maybe 65. Then in this way, they are able to get the bariatric surgery. So this age group of 25 to 70 years covers the age group of most of the people who listen to me. In general, there is more risk with any kind of surgery in old age. However, bariatric surgery is most effective in the younger individuals. Many doctors consider it ideal to have the surgery between 35 and 55 years and maybe stretch it to 40. So what then are the benefits of bariatric surgery? Of course, the first one that's most obvious is weight loss, which eventually gives somebody a better quality of life. And sometimes it gives a resolution or an improvement of some diseases, such as type 2 diabetes, high blood pressure, sleep apnea, and joint pain. So what risks are associated with bariatric surgery? Just like I've said, there is no surgical procedure that is without any risk. There's the risk of infections, bleeding, and one of the most traumatic is a leaking sleeve, which may necessitate additional surgeries. Nutrient deficiencies are common because you can't absorb all the food. And sometimes there's also bowel obstruction, which still calls for additional surgery. So if you're finding this video useful or interesting, please give it a like and subscribe to this channel so that I can continue to bring you more of such content. So what is the cost of bariatric surgery? The cost will vary from place to place depending on where you are in the world. But in general, paying out of pocket is cheaper than paying through insurance. So in my part of the world, decent bariatric surgery will cost about $8,000 to $10,000 in 2025. And unfortunately, bariatric surgery is not usually covered by most insurances. So you have to pay out of pocket. In some parts of the world, if you meet a certain BMI criteria and you have associated medical conditions such as maybe diabetes or kidney disease, the government or insurance may pay. Where the government pays, the waiting period may be 2 to 3 years. So if you are able to get this money, is $8,000 or $10,000 too much to pay? What will it cost you if you don't pay for this weight loss surgery? Usually, obesity progresses with associated disease to diabetes, then kidney failure, heart disease, which eventually lands you in ICU or the intensive care unit. In my part of the world, one day in ICU costs approximately $1,000 US, while kidney dialysis costs about $100 US every week. This is not to mention the many years of suffering and the trauma to which it exposes your family to. Sometimes this window of suffering may even last 10 or 20 years. So, what is my opinion on bariatric surgery? Try all you can to lose weight by diet and exercise. There are many suggestions on this channel to help you lose weight, and there are also many suggestions on how you can progress in your exercise program. When you've done all you can and you have failed to lose weight, bariatric surgery is an option that can save your life. Have you had bariatric surgery, my dear viewer? If you have, please share your experience in the comment section. Or if you are obese or were obese, would you consider bariatric surgery? Let us demystify bariatric surgery. Let us destigmatize bariatric surgery. Let us have this conversation. See you in the next video.